There was a scathing finding by the Health Ombudsman on Wednesday when it comes to the state of affairs at the Kimberley Mental Health Institute. He found that the deaths of 3 patients could have been avoided. He said that the facility's failure to restore power that had been cut due to vandalism for over a year caused the death of the 3 patients. But joining me now is the DENOSA Northern Cape spokesperson, Dimpho. Thank you so much for joining us. Just to get a sense of your thoughts as DENOSA on the findings by the Health Ombudsman.
Thank you very much, Junior. Indeed, our condolences to the families for the life that has been lost. Indeed, this is what we had expected based on the state of health in the Northern Cape. Nothing of a surprise.
One of the things that he said was that there is a challenge when it comes to senior managers as well as senior doctors who can oversee the nurses that are doing their jobs both at the Kimberley Institute as well as the Robert Mangaliso Sobukwe Hospital. Is this something that you've experienced as DENOSA in the province?
Indeed, early last year there was an approval of an organogram that guides in terms of the appointments and also to address the shortage of staff or the vacancy rate in the department. But when you look at the senior managers, you only have the MEC that is appointed. Otherwise, the entire team of the senior managers, all of them, they are acting. And of course, you cannot expect much from the individual who's acting, because automatically they can't take any strategic decision because they might not know when long they will be there. And of course, Minister has put it blind that there seems to be a non-existence of leadership in the Northern Cape Department of Health.
The reason why I was asking also is because the Health Ombudsman himself said that if there are no senior nurses, South African senior nurses, then they should appoint foreign nationals. Just your thoughts around that as DENOSA.
Our thought is that we cannot necessarily say there are no nurses in South Africa. In South Africa alone, we have plus minus 200,000 nurses who are unemployed, who are just lingering around in the country. So why will you go outside the country whereas there are still nurses who are unemployed? Same with the doctors. Why will you go outside when there's still more nurses to be appointed in the country? Because institutions continue to produce nurses, but they are not being appointed.
Okay. And lastly, the Ombudsman said that they should he has given recommendations basically on what should be done. Do you believe that those recommendations that were in that report are going to be implemented in this province?
We don't have a problem with the recommendations and the implementation, but our challenge is that the report is silent on the MEC of Health and the HOD of Health, because those are the first respondents when it comes to the healthcare services in the province. Let the report first be, let the report talk to them. How are they going to be dealt with? Then we can look at all other one who is implicated there. Because if there are systemic challenges, why will you go to charge someone who does not make any decision in terms of the system? Rather deal with those that are decision makers who let down the system.
Thank you so much. That is the DENOSA provincial spokesperson there speaking about the silence when it comes to this particular report. When it comes to the MEC as well as the HOD, he would have wanted to see some findings when it comes to these two individuals, because they are the authorities when it comes to health in this province. For Newzroom Afrika on channel 405, I'm Juniour Khumalo in Kimberley.